1 cc versus 2 cc.
Yeah. So it's a big problem because quality, this is the part government doesn't get. You can't put a price tag on quality in medicine. Yes, sir.
Yes, what about medication for Barrett's? Like, every dose of the trials?
Yeah, I mean, so it's a great question that there's never been a study. There's always been the association or the assumption that PPI use, Prilosec, all that class of drugs, will prevent Barrett's. And will prevent esophageal cancer. But there's never been a study to show that, and there won't be ever a study. It's very difficult to have that study. The question will be is that obviously we're putting patients much earlier on these drugs. So 20-year-olds, 30-year-olds. The question becomes now is when they get to 60 or 50, 60, 70, are they getting Barrett's? That's the only way to prove that these drugs will prevent Barrett's. But we know this, that we know that if it prevents reflux, then reflux causes Barrett's and esophageal cancer. Now the other whole thing I didn't want to get into is the whole issue of bile reflux. So you take an antacid, and gastric acid is less, but you're not doing anything for bile reflux. And there is this theory that bile reflux may be actually causing esophageal cancer. Yeah. Yes?
Well, I've got this, says acid controller, and it comes from Costco, and it's Famotine. I don't even know what acid drug it is.
So it's a hydrogen blocker.
That's okay, so that's the...
It's like the Pepsids, the Zantacs, the Tagamettes.
Okay. It's very cheap. It seems to work.
It's great.
Why would I want to go up to the Protonix?
You wouldn't. You wouldn't.
No.
Yeah. If it's controlling your symptoms, great. But also, if you've had reflux for a long time, it's probably worth getting an endoscopy at some point. Just to make sure you don't have Barrett's. Yeah.
Is there any risk about endoscopy, do it frequently?
Oh, okay. Very good question. So, obviously any procedure has risks. Endoscopy is among the lowest risks in anything that we do from a GI perspective. You are sedated for the procedure. There are a handful of patients that don't want sedation because they're more afraid of the sedation, which is probably actually more risk than the procedure itself. But risks of sort of bleeding, infection are extremely rare, and the risk of like a perforation, which is an accidental tear or hole, extremely rare. Repeated endoscopy, there's absolutely zero risk to it. Zero risk.
So it's like even people annually doing it, it's not. Okay.
Yeah. No risk. Yeah.
Are there any foods that would cause reflux for to make the esophageal sphincter relax and give you reflux?
Well, so the biggest that people have said is those foods that are going to sort of increase acid, or really the bigger foods are the ones that are heavier, fattier meals. Because what happens with heavier, fatty meals is that they sit in your stomach longer until the gallbladder gets revved up and some other juices get revved up. And so the biggest thing of why you get more reflux is stuff has to go this way or this way, right? And the stomach is impatient. So if you're going to take a big meal, you're going to have a big steak, and you're going to have wine, and then you're going to have dessert, well, you're giving yourself a huge load that's going to be sitting in the stomach. Now, our stomach normally empties every 90 minutes. You get a big contraction. But if you're already someone who's prone to reflux, now you're eating these foods, all this stuff is sitting in there, you're already secreting a lot more bile acids and gastric juices. Those are the kinds of things that will set you off.
I had reflux twice. Both times was after eating chocolate laying down.
Yep, there you go. So chocolate, all of that it relaxes the lower esophageal sphincter. Wine, spicy foods. People always joke about Indian food. So there's a particular spice that is in all Indian foods. It's actually ironic because that spice is being used now for everything. It's actually been looking in as a treatment potentially for pancreatic cancer. But it causes horrendous reflux, because it relaxes that LES, which is it's called turmeric, for those of you that know. Yeah. It's great for everything else. Yeah.
Yeah, I am more interested about the bowel reflex because I think myself after my gallbladder removed,
Well, that's when you'll get it.
then I start have the reflex problem.
That's right.
I blame that because before I don't.
Right.
After I have the remove, then I have the problem.
That's right.
So what?
So what can you do? I mean, there's a medicine that helps bind up some bile salts and bile acids, and that will help the bile reflux. The other thing is a motility agent that prevents, because it's interesting. If you think about it, bile is produced, or empties into the second part of the small intestine. It's going into your stomach, and then it's coming all the way up.
Mm-hmm.
So if you can have a motility agent that sometimes is pushing it down, then you're having less of this reflux.
So what it causes because of there's no bile the gallbladder to storage the bile, so the bile constantly to come in,
Right.
and that is caused the reflux.
That's right. Mm-hmm. Yep.
Has a lot of medications can that cause reflux?
Depends. I mean, depends which medications you're on, but sure. I mean, we know that the common culprits of sort of acid or ulcers, are that class of drugs we call the NSAIDs. So the ibuprofen, the Motrin, the Aleve, naproxen, all of that can lead potentially not necessarily to more reflux, but maybe more acid production. Yeah.
Well, I've been told, I had the endoscopy
Right.
a while back, a long time ago, that I take quite a few medications due to chronic pain and everything, some other things too. But he told me not to drink any sodas.
Yep. More carbonation, sure.
And I drink it, and then all the bubbles come up.
Yep.
And
I mean, the other common things are like Fosamax, and that's why they tell you to keep yourself elevated because it causes a horrendous esophagitis. So that class of drugs. I mean, there's a lot of sort of common culprits that will do it. I think the other thing you point out is the general rule of don't take any medicine and then lie down, because you will get a pill burn in the esophagus.
Yes.
Yeah.
it hurts a lot.
And it's quite painful. The most common culprit's antibiotics, but anyone can do it.
Right.
So, and it's the other thing. The other part of this I didn't mention was also looking at, we were talking about peristalsis, but we're really talking about motility. So, motility disorders in the esophagus, especially, can also contribute. There's a whole host of those disorders that we deal with that can contribute to more reflux. I think the biggest piece of advice I have, when the mortality and the morbidity with esophageal cancer is so bad. I mean, it's on the same level as pancreatic. And often when I see these patients, they've ignored a lot of these symptoms for years. And, obviously it afflicts that population that never goes to see doctors, which are men. And when you really look back and you take a careful history, well, I've had some troubles for some time. I think the other part of this is that I can't emphasize enough is exercise and weight loss, because it has a dramatic impact on just your digestion, but also the reflux issue. Yeah.
Thank you for the talk. Excellent. In the last 10 years, the screening for colon cancer, colonoscopy, has really become very embedded in preventive care. Do you foresee that happening with a certain segment of the patient population with respect to esophageal?
This is what we're hoping to do now. Yeah. And that's sort of that last slide, which is that particular group of patients, I think should get an index endoscopy. I think that